everyone. Welcome to the Young Bones Podcast, your own podcast with our Paediatric Orthopaedic surgeon, Dr. Easwar, to help you with doubts about common bone, joint, and spine problems in children. Welcome, Dr. Easwar.
Thank you. Clubfoot. That's what we will be discussing today in Young Bones podcast with me, Dr. Easwar T. I am a pediatric orthopedic surgeon. I specialize in care of children with bone, joint, and spine diseases.
Great.
So, clubfoot, it's condition that twists a newborn's foot inward, affecting 1 in 1,000 babies. But what if I told you this seemingly devastating diagnosis is now treatable with astonishing success rates?
Wow, that's certainly an intriguing opening, Dr. Easwar. Can you tell us more about what exactly clubfoot is and why it's such a significant condition?
Well, clubfoot is a congenital deformity where an infant's foot is turned inward, often so severely that the bottom of the foot faces sideways or even upward. It's caused by short and tight tendons connecting the leg muscles to the foot bones. While it's not painful for babies, if left untreated, it can lead to significant problems later in life.
That sounds quite serious. How common is this condition?
It's more common than you might think. About 1 in every 1,000 live births will have clubfoot, making it one of the more common congenital foot deformities. Interestingly, boys are twice as likely as girls to have this condition, and in about half of the cases, both feet are affected.
Those are surprising statistics. Is there any way to detect clubfoot before birth?
Actually, yes. Many cases are first discovered during prenatal ultrasounds. This early detection can be crucial for parents and healthcare providers to prepare for treatment right after birth. Speaking of treatment, the good news is that with proper care, the majority of children with clubfoot can enjoy a wide range of physical activities with little trace of the deformity.
That's incredibly encouraging. What are the current treatment options for clubfoot?
Well, the most widely used technique is called the Ponseti method. It's a remarkable approach that uses gentle stretching and casting to gradually correct the deformity. The process typically begins shortly after birth and involves weekly casting for about 6 to 8 weeks.
That sounds like a long process. How do babies and parents cope with this treatment?
You're right. It can be challenging, but here's where it gets interesting. After the casting period, about 90% of babies need a minor procedure called an Achilles tenotomy. It's a quick procedure where the doctor uses a very thin instrument to cut the Achilles tendon, which is often still too tight. A new cast is applied, and in about 3 weeks, the tendon has regrown to a proper longer length. It's amazing how the body can heal and adapt like that.
Wow, that is fascinating. But I'm curious, once the foot is in the correct position, how do they prevent it from reverting back?
That's where the real commitment comes in. To maintain the correction, the baby needs to wear a brace, often called boots and bar, for several years. At first, it's worn almost full time, 23 hours a day. Gradually, this is reduced to just overnight and nap time wear. The bracing program typically lasts for 3 to 4 years.
Oh, that sounds like quite a challenge for families. How do they manage such a long-term treatment?
You're right, it can be demanding. But many families find ways to incorporate it into their routine. Some parents even get creative. They decorate the braces or turn brace time into special bonding time. It's all about perspective and commitment to the child's long-term health.
That's a great way to approach it. Are there any alternatives to this method?
Yes, there's another non-surgical method called the French method or the functional method.
Oh,
It involves daily stretching, manipulation, and taping of the foot. usually under the guidance of a specialized physical therapist. This method also requires significant family involvement and commitment.
Hmm. Both methods seem to require a lot of dedication. What happens in cases where these non-surgical methods aren't successful?
Yes, well, in some cases, particularly when families have difficulty following the treatment program or when the deformity is very severe, surgery may be necessary. This can involve adjusting the tendons, ligaments, and joints in the foot and ankle. However, doctors try to avoid surgery if possible,
Hmm.
as it can result in a stiffer foot, especially as the child grows.
I see. And what about the long-term outlook for children with clubfoot?
That's where the story gets really encouraging. With proper treatment, most children can have a nearly normal foot. They can run, play, and wear normal shoes. While there might be some minor differences, the affected foot might be slightly smaller or less mobile, and the calf muscles might be smaller. These usually don't significantly impact quality of life.
That's wonderful news. Are there any ongoing challenges these children might face?
Well, the affected foot is usually 1 to 1.5 sizes smaller and somewhat less mobile than the normal foot. The calf muscles in the clubfoot leg will also stay smaller, so the child may complain of sore legs or getting tired sooner than other children their age, but these are generally manageable issues.
It sounds like with proper treatment, the prognosis is quite good. Do you have any advice for parents who might be dealing with this condition?
Absolutely. The most important thing is consistency in following the treatment plan. It's also crucial to work closely with your healthcare team and don't hesitate to ask questions or seek support. Remember, dealing with any medical condition in a child can be stressful, and it's okay to lean on others for help.
That's excellent advice. As we wrap up, what's the main message you think our listeners should take away from this discussion on clubfoot?
I think the key takeaway is that while clubfoot can be a challenging diagnosis, it's a treatable condition. With early intervention and dedicated care, most children with clubfoot can lead active, normal lives. It's a testament to the power of medical research and the resilience of the human body and spirit. And it's a reminder of the incredible impact that dedicated healthcare professionals and committed parents can have on a child's life.
Well said. It's truly amazing how far we've come in treating conditions like this. Thank you for sharing this fascinating information about clubfoot with our listeners, Dr. Easwar.
It's been my pleasure. And to our listeners, remember that knowledge is power. If you or someone you know is dealing with clubfoot, don't hesitate to seek out information and support. There are resources available and healthcare professionals ready to help guide you through the treatment process. Until next time, keep exploring the fascinating stories that shape our world. This is Dr. Easwar at Young Bones Podcast, signing off.
So, until next time.